Hello, and welcome to the Glossy Beauty Podcast. I'm your co-host, Lexi Lebsack, West Coast correspondent at Glossy, and I'm joined by my co-host, Sarah Spruik-Feiner, senior reporter at Glossy. How's it going, Sarah?
Good. How about you?
I'm good. I have a very exciting episode. I'm so excited to get into this one. It is all about stem cells and growth factors and all of this kind of cool science-y skincare stuff that I think is where the luxury skincare market is going. So I'm so excited to share this one. Have you done any weird science-y or any kind of strange or interesting or unusual beauty things?
I mean, I know almost nothing about stem cells, so I'm going to be learning from you on this one. The most adventurous, I guess, so to speak, skincare ingredient I have used is really snail mucin and K-beauty. I think I've maybe even talked about it on past episodes. I worked in the K-beauty space for a very brief period when it was first blowing up. And I was even writing the blog post introducing U.S. consumers, which obviously I am a U.S. consumer, to snail mucin. And it's really good for acne. And I think even I shouldn't be now it's almost a decade later and I shouldn't be talking about it anymore. But I think it has wound healing properties, and it turns out to be good for the skin. What about you?
My mom texted me the other day and she goes, "Do I need snail mucin?"
Oh my God, she's on it.
I think the wildest thing I've probably done is years and years ago for a video project at one of my former employers. I did a episode that was sort of about stem cells and then sort of human-derived stuff, but very different from what we're talking about today. But I did, for the episode, I got what is, referred to in LA as the penis facial, which is an esthetician. I won't mention her name, but an esthetician from the UK does this facial where she uses a stem cell-like serum that is derived from baby foreskin, which is, of course, very controversial. I know. Very controversial, but I think it was Sandra Bullock, if I remember correctly. This was years ago, but I believe that it was Sandra Bullock, and she had gone on a talk show, and they were like, "What's the secret to your beautiful skin?" And she was like, "It's called a penis facial," and then it went viral. But basically, this facialist would use a sort of a copy of the stem cells and growth factors and other things that sort of come from baby foreskin.
So it wasn't the baby foreskin itself.
There's two worlds in which sort of brands play in this world. And one of them is taking stem cells, growth factors, all of that good stuff, and making a identical copy of them, or in terms of where we're at with science now, as close as we can to an identical copy. And I think that kind of removes some of the scariness for a lot of consumers. And also it allows the brands to sell into markets that don't allow human-derived stuff. So the EU, for example, you can't sell human-derived stuff in the EU. So what we're talking about today is not available for sale in Europe, but you can sell the sort of copies of it. And we see a lot of brands that are doing this right now. So, we see that Dr. Diamond has a line and it's the copy of stem cell material. Eighth Day is another great line that has copies. There's a ton of them out there and all really great stuff, and they're copies. And then there's an other side, which we're talking about today, and that's human derived. And that's really when the stem cells come from a human being and then they're put into almost a human-like environment that's sort of brothy and liquidy. And the stem cells, which are, for anyone listening who doesn't know, they're sort of like master cells. They have all your DNA in them. They're like a master cell from you. And they put them into this, human-like environment in a very high-tech sciencey lab. That is, of course, approved by all of the regulatory stuff in the US, which there's a lot of for this. And then they excrete the exosomes and they excrete the growth factors and the cytokines. And I don't want to get too sciencey because I don't even understand this stuff fully, but they basically excrete all of these really interesting little, I sort of think of them as little letters, little like an email or a letter. And they're basically something that comes out of the master cell. and then they can tell other cells like what to do. So they'll be like regenerate and do this and do that. And so that's sort of the mechanism behind it. But so there's two worlds. There's the copies and then there's the human derived.
Interesting. The copies are also, I think, another benefit is like they're palatable, sellable to anyone who's like vegan too, right?
Oh, that is so. I haven't even thought about that. I don't know. I guess a vegan might not want a human derived.
I think
a human derived product. Yeah, that makes sense.
I think so. Or
weird.
Yeah, I don't know. I'm not sure. Anyway,
no, you're probably right. That actually makes a ton of sense. But yeah, so the this world is really interesting, and we're going to sort of follow the story for this episode of Angela Caglia, and she is an esthetician. She has been making skincare products under her name, Angela Caglia Skincare, for 7 or 8 years now. And they sell at places like Revolve. They sell DTC. They have like a pretty good little business there. It's just her and her husband. And of course, they have like contractors and freelancers and vendors and all of that kind of stuff. But basically, it's a very small team, and she's based in LA, and they are having their hockey stick moment right now. They're having their big growth moment, and it's all because of this serum that we're going to talk about. And the sales went up 437% in the past year. So she told me in the pod that they're going to close this year with $4 million in sales, and 90% of that will be the serum that we're talking about today, Cell Forté Serum. It's very exciting. She's also putting it into a eye cream and a face cream, this technology, for maybe next year. But it's really prompted a lot of attention for her. She keeps getting these beauty industry awards from places like Elle and Byrdie and Essence. She's sold out 3 times, she told me, at Violet Grey. And then this has also been the catalyst for her brand's expansion into Nordstrom, which is happening literally right now. It's been this big, big year for her. And yeah, she's completely focused on this serum. It's pretty pricey. It's $3.95 for 1 ounce, which I mean, I'm assuming an ounce will probably last you a month, less than a month. But their value proposition is sort of that it replaces everything. Like you don't need a vitamin C or a vitamin C, a vitamin E. You don't need hyaluronic acid or retinol or peptides. You don't need anything. You can literally just wash your face and put this on and then put some moisturizer on, and it kind of does everything. She certainly isn't the only person using this type of technology, but like she says in the episode, it's very expensive. It's very complicated. She found the manufacturer that she uses. She found that when she was doing research for her mom's ongoing dementia treatment, because stem cells and this science that she's putting into this topical serum, this skincare, really comes from a medical place. So people can have stem cells injected into their shoulders. They can have them used for all kinds of medical procedures. But yeah, it's she is one of the early ones that are kind of adding this into a skincare that you can just kind of like go buy at Nordstrom.
I'd be really curious if people are like purchasing month over month, or if it's mostly like new customers trying it out. Because like if you buy that every month, I mean, wow.
I know. No, she told me that her subscription rate is insane.
Wow.
So she told me that they have a 51% subscription rate. So a lot of people are coming back. And I think that the change in her business is that she's tapping into this like world of the 1%. And she told me anecdotally that, people will buy one and then she'll get another order from them the next month for like 4. Like people, they see results, they see things happening in their skin, and then they just kind of go for it. And, she's selling to, I mean, it's the 1%ers.
Yeah.
It's the very wealthy.
Super interesting. And I think that's really smart what you're saying about this being potentially like the future of the luxury skincare market. And I've just like noticed so many sort of cool girl types, so to speak, posting being like, this is really working for me. So I think you're onto something with that too.
It makes a lot of sense that this is sort of where luxury skincare would be going. It's like the regeneration of the skin and of like everything that's happening. I think in Angela's studies, they found less pigmentation, more hydration. I mean, but it makes sense because you're basically putting in the growth factors, exosomes, cytokines, all of these things that are excreted in the lab from the stem cell. I mean, they come from like a 20-year-old. So you're basically sending these messages, these like very youthful messages to the skin to do these things. And it's weird because we don't really completely know like what the growth factors are saying. We know that there's a lot of complicated science that will probably be, I guess maybe better understood in the years to come. But I'm skipping ahead a little bit. So I'll tell you just sort of how it works, which is for Angela, they use adipose tissue, so like fat, from a patient who is undergoing plastic surgery, getting liposuction. And she told me that they, tend to get it from people who are like 20, 21, 22, so very young people. And then they take the fat, it goes to this lab. They have to donate it to science. And then it goes to this lab where they're making it. They put the stem cells in a human-like environment and they excrete the growth factors and all of that stuff. And then they take out the stem cell before they put it in the bottle. So you're not actually getting someone's like DNA or anything. And they're, of course, testing it for like every known illness and pathogen and virus and all of that good stuff. But you are getting the growth factors that their cell excreted. So it's definitely sciencey.
I'm not gonna lie, it makes me a little antsy, but I noticed you said donate, so they're not getting paid for their quote contribution.
No, and that is because it's actually illegal to sell body parts in the US. So, I think that's probably for like obvious reasons, but yeah, they have to donate it.
Crazy.
I know. It's really interesting stuff. But yeah, it's a cool episode.
Cool. I can't wait to hear the interview.
Angela, welcome to the Glossy Beauty Podcast. I'm so glad to have you here.
Thank you, Lexi. I'm so excited to be here with you today.
I have been wanting to have a conversation about stem cells and growth factors and this whole side of the skincare ingredient innovation world and where it's going. And I can't think of a better person to have on to talk about it than you. So I'm so glad you're here.
Thank you. We're so excited to be one of the first to launch commercially to kind of change the narrative on skincare and give it a new spin on what science really has to offer and how we can look younger and better and feel better.
Yeah. I feel like skincare for the last several years, decades, has been all about retinols and vitamin C's and sort of exfoliation. And you sort of come at things with a very different perspective, which is, I think, very interesting.
Yeah. Having been an esthetician for 30 years, I've worked on so many faces. And yes, I work on a lot of celebrities and I work on a lot of just amazing people over the years. And I've just noticed when they come in, if they're a new client, they are using so many products that have actives like vitamin C, like retinol, like the peel pads that are completely sensitizing their skin barrier in a way that isn't healthy. Mm-hmm. And they're not looking younger, they're not looking plumper, they're not looking dewier, and their pigmentation isn't moving. So it's been frustrating to be a part of this with them and seeing what these products are not doing for their skin.
I really love this perspective because I feel like so many estheticians and skincare pros are all about the exfoliants and the retinols and the vitamin C. I know. But anyway, so most listeners, I would argue, especially ones who were around in the early 2000s, probably have a very specific idea or picture that pops into their head when you mention stem cells. So I'm curious as to sort of how you describe these ingredients and your technology to a prospective customer. So sort of like, what's your elevator pitch on this new sort of direction you're going in?
Yeah, right now, currently, stem cells are disrupting medicine. It's called regenerative healthcare. We're seeing when we walk into something like Next Health or even some dentist offices that they're offering stem cell injections for shoulder pain, for pain in your knees. They're actually offering it now in derms offices for filler replacement stem cells. So it's becoming well known in terms of the efficacy and also in light of regenerative medicine. I discovered myself the stem cell path when I was looking for something for my mom who was diagnosed with dementia. I knew that there was regenerative medicine, which they were having such incredible clinical trials on, injecting stem cells into the brain to regenerate that organ, which is hard to operate on. So there's a lot of movement there. And then also for heart attacks, they're injecting stem cells into the heart. So I'm like, wait a minute, our skin is our largest organ. And I did a little research and I found out that they are using the byproduct, not the stem cell, because stem cells wouldn't last in my jar and they certainly wouldn't penetrate your barrier. But what they produce, which is the real magic of the mesenchymal stem cell of our bodies. And what they produce, we create body-like conditions that duplicate and create those thousands of exosomes and growth factors and cytokines that go into regenerate and repair. So we're doing it topically, DNA-free to the largest organ, the skin. And it's absolutely remarkable, the breakthrough with this skincare product. We've won 5 awards already. We just have been around for 1 year with this product.
Wow. 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 Okay. So for someone who really has like no idea about this world and doesn't understand stem cells or growth factors or any of this really sciencey stuff. So explain to me where the growth factors come from or where the stem cells come from and then how they're sort of turned into growth factors. And that's sort of a rough way to describe it, but you tell me.
Okay. Yeah. I'll try and make this as easy as possible. I'll go back to the beginning. When we're born a ball of stem cells. Like that's what we are. We're a ball of stem cells. And actually before we're born, we're a ball of stem cells, the mesenchymal stem cell and a blood stem cell. The mesenchymal stem cell is the one that becomes everything. It becomes your heart, your brain, your organs, your hair, everything. As we age, it declines the mesenchymal stem cells in our bodies. So when you're younger, around 4 or 5, if you scratch your arm or you do something like we all did when we were young and clumsy, it heals quite quickly. And as we age, when that's declining, the mesenchymal stem cells, that's not happening as much. So when you see an older person with major bruising, they don't heal as well. It's because of the deficiency and the loss of the mesenchymal stem cell. So these do decline with age, which is why we do see the signs of aging happening when these start to decline around 25. So what we're doing is we are harnessing the power of that stem cell. So the real superhero of our bodies. So what we're doing is taking 1 teaspoon of adipose tissue, and it's not done by me or anyone. Basically, it's done by a plastic surgeon, and it's sent in from healthy consenting adults, 1 teaspoon of adipose tissue of fat during liposuction procedures sent to my clinical research, stem cell research lab, which is one of the foremost in the country. And what they do is they're able to extract the stem cells, and then they create body-like conditions, and they grow and duplicate the stem cells, and they drink and excrete, I'll call it a broth or a culture, which is also called conditioned media. And what happens is it's a liquid. We keep pushing out the stem cells and then taking the liquid. And this liquid has all of the magic that the stem cells produce naturally in our body because we've created body-like conditions. And those are the exosomes and the growth factors. Those are able to go in and repair the damage topically from your skin and able to regenerate just like it would within your body, but in a topical manner. And it's something that, the other doctor brands, and there's nothing wrong with synthetic or, biomimetic, as some people are saying, but that's just a chemical version, and also a peptide is as well. It's a chemical version of what our body does. So they're going in, and those are effective, they work, but we're actually utilizing the real thing. And it's something your body, your skin recognizes. So the results are that much faster and they're that much better. And it never sensitizes your barrier. So you're not dealing with any of the sensitivities of vitamin C or retinol, which I've never been a fan of any of those products, having been an esthetician for 30 years. And every 10 years, there's always some innovation, whether it's a vitamin C or retinol. Well, now is the time. It's literally exosomes, growth factors. And the biggest innovation is cultivating the regenerative medicine aspect and utilizing true stem cell conditioned media, which is what we've done. And it was kind of a risky move. And it's, there is a perception of stem cells. Oh no, is it from an aborted fetus or, something terrible, which is, back in the days of Bush era when there was a lot of controversy. But we were meeting with everyone, my PR team before we launched, and we're like, oh no, everyone's going to just say this is something really crazy and disgusting. And luckily we haven't really had that, just a few here and there on some ads, but my customer gets it. She understands it. She had pain in her shoulder. She had stem cell injections. She's going in and going to her derm and getting the exosome application after her $3,000 laser procedure. Well, I'm offering that in a bottle at home where you don't need to pay that much. And you get even better results than going in and getting the laser or microneedling and having them apply after.
Wow. This is so fascinating. Okay, so the stem cells are taken from the donor person, and then they excrete the exosomes and the growth factors and all this, and then the stem cells are removed, and that's what has like the DNA of the person, right? And then it's just the growth factors, exosomes, that's what goes onto the skin.
Yeah, they're duplicated in vitro in the lab, and it's all done in a CGMP certified lab. There's no stem cells in the bottle, and it's just the exosomes and growth factors, DNA free. And to keep those stable, those are immediately frozen. And those are shipped frozen to my chemist who has experience working with conditioned media, and he formulates this with us. So stem cells are very fragile by nature, and kind of what makes our bio-MSC, which is my proprietary blend of the stem cell and the bioidentical, what makes it so special is that my lab does it by hand. And there are a few competitors out there that are sold in medical offices that offer human stem cell conditioned media in their product. And what makes ours different is that it's done by hand. The stem cells are very fragile, and they'll stick to the bottom of the clear flask. And they're all in hazmat suits, and they've got all the computers up, and they're doing it right there. And I can't even get in there. I'm just watching behind the big glass. And they are actually watching the stem cells clump to the bottom and making sure they're viable, because it's really important to make sure you're getting a good amount of protein-rich, basically exosomes and growth factors. And there's literally thousands upon thousands of them. So our process is different than most, and that's why we have a patent on the process, because it's so protein-rich and it's so efficacious. So a couple other competitors will do it like in a big wine vat, like the big, I call it a wine vat. That's a skincare vat, but it's just basically the big metal. And they can't see the stem cells, and they don't know the viability of them. And that's when you see a product that's a lot less expensive than my Cell Forté Serum.
Wow. Okay. And then the growth factors, they're like little messages, right? They're like, I like in my mind, I was going over this and I'm like, they're like little letters where they're like telling your body to do, they're like telling your body to do something, right? But you don't like fully know what all of these thousands of messages are. We just know that they're like rejuvenating the skin because they're sending these messages, right?
Exactly. They're regenerating. Okay. And it's actually the exosome. So I call it like either an envelope where that's the letter they're sending, which has all the growth factors and cytokines and all of the, a peptide is a building block to a protein. So that's included as well. So all of these wonderful ingredients that go into regenerate and transform your skin are delivered. And it's a cell-to-cell communication within the cells of your skin. And, I've noticed 3 months in using my Cell Forté Serum, I've always said, as an esthetician of 30 years, and this is just how remarkable it is. This is not like another ingredient. And when I told my PR department when I launched this, I said, this is not a serum and a founder's just saying this is great. I go, I need to tell you how groundbreaking this is, because I wanted to let them know. And and I want your audience to know this is a revolution. Just like it is for healthcare, it is also now for skincare. I've always told my clients, nothing you buy over the counter is ever going to take away, I'm 53, a sunspot here, a sunspot there. It's just not. And you need to go get IPL, intense pulse light. You need to do something. Don't waste your money. Within 3 months of using my Cell Forté Serum, it was completely gone. And not only that, my skin is hydrated, plump, and dewy, and it just has this uniform texture. The pores appear to be smaller, and there's just such a unique look in terms of the fine lines and wrinkles. I usually get injections once a year for my birthday. This year I didn't need to. It's truly groundbreaking, and it's just so satisfying for me as an esthetician, because my goal is always to give something where a woman feels better or a man. And instead of my hands doing it, I'm doing it with this product. And I mean, I can just tell you at some point when we get into the discussion, just the sales are just, and the repeat purchase rate and the satisfaction rate and the customer reviews are just unbelievable.
Yeah. Wow. Okay, wait. So you're seven years in on your business, right? Is that about right? 7 or 8?
Yeah, I launched Angela Caglia Skincare 7 years ago with my husband. Yes.
Okay. And you are just now having this like massive hockey stick growth moment, right? And it's all about this serum?
Yeah, and I've actually been working on the serum for quite some time. This is like my 5th iteration, and it took a while to get everything together. And to be quite frank, it's very expensive to have this ship frozen. It's not just your regular contract manufacturer ingredient. So I've been working on this. I've also studied formulation chemistry and cosmetics at UCLA. So I really have gotten into this role to create, my whole goal was to create the most potent anti-aging serum over the past few years. So having the brand, the pandemic, I had a lot of time to really dig in here. So it's been in the works for quite some time. And we just launched a year ago at Violet Grey, and we sold out within an hour of launch. And we sold out again within an hour when we restocked them that very week. And we are still proudly their top seller, even more so than the other doctor brands, which I'm not going to name, but we have been their #1 bestseller since we launched at Violet Grey, which is super exciting.
Wow. And you're also expanding right now, right? You're going into a new retailer. You're going into Nordstrom. Are we allowed to say that? I know you told me that last week.
Yes. We're launching into Nordstrom, and I'm going to give you an exclusive. We're also launching into Blue Mercury.
Oh, wow. Exciting.
Next year. Yeah. February of 25.
Wow.
Yeah.
Well, I don't think that, it's that hard to convince people, especially when they see your before and afters and all of the sort of, data and everything. I don't think it's hard to convince them it works. I think maybe the challenge is just like, educating people about this kind of thing. I know we talked a little bit about, the top of the call around like, injections in your shoulder, and people are becoming a lot more aware of this. Is there any kind of like nuance, or is there any kind of like messaging that you have been seeing success with? Like, how do you sort of like explain, because obviously the product is expensive and also like novel. How do you sort of like get people to jump in?
Well, when I let them know it replaces your retinol, vitamin C, hyaluronic acid, and peptide serum. So it's actually a value. So the $395 price point, and even it actually replaces some laser or Botox. So in terms of the value, it's incredible. So once they understand, wow, I don't need to buy, my vanity doesn't need to be filled with the retinols, the vitamin Cs, the peel pads, the peptide serums with the doctor name on it. They get it, and they like it that it's a 4-in-1. And people want things to be simpler. We're tired of using so many products. So I think once I mention that and they understand the efficacy of a truly medical grade, quote, product that isn't just marketing speak, they're happy to replace all their other products. And sometimes I'll get someone that'll say, well, do I apply my peptide serum after, or do I put my retinol on before, or vitamin C? And as an esthetician and also now formulator, my mind is like, why even do that? Like, this is going to give you better results than any of that. Mm-hmm. So for some, I'll say just, taper that out, apply it to different parts of your body. Others that are really adamant that still want to use their retinol or their tretinoin, I'll just say you can apply the Cell Forté after and just kind of cycle those in 2 nights a week, because the Cell Forté goes in to regenerate. So whatever that is doing to your barrier, which is a little invasive, you can apply this on top to regenerate and also help you look younger and make your skin firmer. And also in terms of the Ozempic craze, this is only going to get bigger because, everyone is thinking, oh my God, the doctors are telling them you need a facelift now that you've lost all this weight. But with the Cell Forté, the tightening, you feel how it's stimulating collagen and you feel plumper and tighter. I'm 53 and I don't plan on getting a facelift. I don't feel I need one.
Talk to me a little bit about application. Is there a trick to sort of like, you're putting all of this amazing science into a bottle. How do you apply it? Do you want to do it on wet skin, dry skin? Do you want to use a micro roller, like a microneedling roller? Like I know that was a big trend before your good serums, but you tell me.
That's a great question. So there's some misinformation out there, in my opinion, in terms of microneedling. Like you may go to your doctor and they'll microneedle you and they'll apply something similar to this,
Yeah.
maybe not as efficacious, to be perfectly frank, because they'll mix it with a powder of the exosomes. They'll freeze dry basically what I have. And that is very expensive. They charge an extra $500 just to apply it. But what you don't need is a microneedling. The microneedling, what that does, it's great for some skin types, not all, but the microneedling will trick your skin into thinking it's been wounded to where it'll rebuild collagen from the inside. So it's activating that mesenchymal stem cell from the inside out. It's not helping the product penetrate better. That's the thing. So you can apply this every morning and night. You don't need to microneedle it in. I don't want you to, because I certainly don't want needles in your barrier. It's not necessary. I do a treatment where I do this clinically, and I'll do a stamping, which is different. It's not as invasive, but not needed. Yeah, it's kind of that misinformation that you have to microneedle to get products in, which is silly.
Okay, talk to me about sales. Can you share anything around revenue or, how this product has transformed the business?
I mean, this is really our franchise. Like you said, it is a hockey stick. I think our sales are up 437% in the past year. Oh. We will do on 85% of my revenue. We'll finish this year at, maybe close to 4 million. And most of that will be this product, the Cell Forté Serum. So we're ordering tons and tons right now to getting my components ready for next year with the launches in store. But this will bring in close to 4 million. And that's like 90% Cell Forté, because that's all we're promoting is talking about this. And I'm working on, of course, a moisturizer with the same technology and an eye cream. But it's transformed the business. Like we'll do 500,000 this month. That's with the Cell Forté and the wholesale order coming in. So 300,000 in direct to consumer, 200 in wholesale. So our biggest month in the history. I know, it's unbelievable. We used to do, before we launched, just to give you an idea, before we launched this product a year ago in August, we did 40,000 that month, 40,000 in direct to consumer. And now, it just keeps growing and growing. And the repeat purchase rate, the subscription, they can't get enough. They're buying it for their girlfriends, their sisters. They are getting a subscription. I think, over 40% is subscription, and our repeat purchase rate is huge.
Okay, so what the listener can't see is that my jaw's been on the ground for the last 30 seconds just listening to you.
I can see, yes.
Wow, that is so exciting. I mean, it's really a testament to years and years in business. I know it's just you and your husband at the company, right? You guys, it's just you guys.
Yeah, we did a friends and family round, and we brought in a couple people a couple years ago. And one of those amazing people happened to be Martin Brock. And he's the former CEO of Sephora and Starbucks and Nike. And he's been an advisor to us. And he's been great to have along with the journey to talk to. But literally, we have no employees. It's just me and my husband. And we're talking about doing a round where we can just hire the staff and scale, just to completely scale the brand.
Wow. Okay. Talk to me about the supply chain for this. I mean, these ingredients must be challenging to procure. I know you are working with the center where you originally went to help your mom with her dementia. Is that correct?
Yeah. And they're in Texas. And basically it's called Hope Biosciences. Okay. And I try and be very transparent with everything. And they do a lot of FDA clinical trials. They're not in the skincare business. I mean, what they do is amazing. Long COVID studies, children with epilepsy, traumatic brain injury. The Navy just gave them $5 million, a grant for studies on traumatic brain injury injecting into the brain. So we really have the premier stem cell research lab, and it's expensive, very expensive, because I want the best. And we're able to ship frozen, and we have to order far in advance. So actually this morning, my husband and I were deciding, doing the numbers and just figuring out how much we're going to need for next year and with the launches in retail. And it's unbelievable. So we're super excited.
Wow. Okay, there is one thing that I thought was very interesting about this whole world, which is you can sell this product and any kind of, thing in this world with growth factors and human stem cells and everything pretty much globally, but you can't sell in the EU. Is that correct? Mm-hmm. And why is that?
The EU, we're working on a biomimetic version for the EU. I'm going to go more in the duplicating of it. The EU is just the EU. I mean, right now you can't even sell some retinols now in the EU. But we're focused on this market. We're focused on the US. It's huge. And I want to conquer this. We can sell to Canada, which is nice. So we're focused on this market. And eventually we are working now to create our EU version of biomimetic. And if someone doesn't want to use this, then that'll be another option for them as well.
Okay. And then talk to me about the future. I know you mentioned at the top of the call, you have other products that are going to become part of this franchise, but talk to me about, the challenges there and what you have coming.
Yeah. I mean, the challenges are, my chemist he's one of the foremost. He's really, there's like 5 top formulator chemists in our country. And he's one of them. He calls me boss because he knows the biggest challenge is me because I'm so darn picky. We worked on the moisturizer and I didn't like the way it felt a little oily after application. So I'm like, you guys, you got to go back to the drawing board, remove 50% of the oil. I want to actually feel instant firming. I want you to help me to find some sort of ingredient that will help my customer feel instant firming as well as long-term with the stem cell conditioned media. So it's just like having worked on women for 30 years, a lot of founders say, I didn't find what I wanted, so I created this, which is their story. For me, it's not even about me, it's about my customer. And that's why I still give facials like 5% of my time because I just want to do this for her and make an amazing product, having devoted my life to this industry and to this client. So the moisturizer will be launching, I think in April or May, because I pushed it back because I still want to do some things with it. And it's going to be, a lot of customers are buying the other brands for moisturizer. So I really want a tightening, efficacious moisturizer. So that's the first launch. And then we're going into an eye cream in September. And I really wanted something that wasn't too heavy, that didn't feel like you had this layer under your skin and not too watery. And I didn't want silicones in it. So we're working on a beautiful formula that really brightens. You know how we put concealer there to brighten? Mm-hmm. I want this eye cream to brighten. And luckily with the stem cell conditioned media element in the bio-MSC, it literally brightens the skin. So we're super excited about that.
Wow. I've heard in the past that active ingredients can be less effective when they're in a thicker cream as opposed to a serum, just because it's not as viscous and it doesn't soak into the skin as well. But have you found that? What's your stance on that?
Yeah, I mean, the molecular structure in the serum is smaller, so it's able to penetrate better into the barrier of your skin. And, in terms of the whole franchise of my line going forward, which is exciting for some people to hear, the serum is the most expensive. So this is $395. So this is like the Grand Cru of a champagne house. This is it, the Cell Forté, because of what you just said. It is a serum and it has a higher molecular structure, and that goes first. And then I'm bringing my price points down. I think in terms of the rest of the franchise, I think a lot of brands will drop another $300 moisturizer. And what you said is a really important point. When it's a cream, the active isn't that much. So I'm going to do a $195 moisturizer, which will be in a beautiful glass, pump. And I'm not going to go over $200 because I just know my customer. And I don't want to be that type of founder where I overcharge for my products when I know that I want them to be loyal and I want them to buy it again and again, and I want it to be attainable. So basically, this is the Grand Cru. This is of course, the serum, and that's going to be the most efficacious and the must.
Talk to me a little bit about who your client is right now. Who is this customer who's buying the serum and replenishing so quickly? And has your clientele sort of shifted from your, the sales you've done the last few years?
Yeah, it's really unbelievable to see who's buying the serum. Just on our own website, we're able to see that information. A lot of celebrities are buying it. The former First Lady of France just bought it. She has a place on Park Avenue. We have heiresses buying it, Chinese billionaires. It's really fascinating. My customer base has changed. And the average price of her home is $15 million, whether she's in Palm Beach or if she's in Aspen or New York or LA, Montecito, Texas. So my customers are the 1%, I would say right now, because one, she's educated and she knows the efficacy of the stem cell and she's not afraid of it. She knows the value in it. And that's my job, is to help people understand that it's not a scary thing and there's no stem cells in the bottle. It's just the exosomes and growth factors. And this stuff really works. So for her, it's a deal. When she was paying $800 for La Prairie with fragrance and all sorts of other ingredients, this is $395 and she gets the value of it. So it's exciting because actually there's another customer base. There's a 25-year-old and then there's a little bit older like myself. We start to lose our mesenchymal stem cells around 25. So if you're able to start applying this at 25, you can help prevent. And there are studies on human mesenchymal stem cell conditioned media where it actually shows that it is preventative of future damage. So there's a customer there. And there's a customer on reparative and regenerative, which is me in my 50s, where I look and feel, 15, 20 years younger using it.
Has it been a lot of word of mouth? Or like, I feel like one big question we always hear in luxury is like, where are the 1%? How do you reach them?
That's a good point. Being a startup, and I really admire my husband for this. He is my partner. He decided to learn himself how to do digital ads and how to learn the algorithms instead of paying someone. So he is the one doing them. And he's actually scaling and doing quite well to get the message out. And we made a conscious choice to put more money. 30% is what we're basically putting in, as you should, for marketing, but we're putting money there because we are first to market commercially with this kind of breakthrough. So we want to get the word out. So a lot of it is through digital ads. A lot of it is through word of mouth. We're finding out people are sharing the love and telling their best friend and their sisters, and then their sisters getting addicted. So it's a combination of both. And I also try to do a lot of content where I educate, where it's just organic as well.
Mm-hmm. Wow. So cool. Well, I can't wait to see with what happens next. I feel like I've been following your brand for years and it's really exciting to see this massive growth. Yeah, of course. Okay. So last question. What advice would you give to entrepreneurs who are on their journey and haven't yet maybe found their big breakthrough hero product like you have in the last year or two?
Well, it takes time. So just be resilient and have the grit, because I was told, in a Sephora meeting years ago, you don't have that hero SKU. And I was just like dumbfounded. I'm like, well, what do you mean? And I didn't have it. So therefore I didn't launch into Sephora. And I just kept going and I didn't give up. And I began working on something that I knew would make a difference. And I think you just need to not have fear and just keep the mission intact, which is just to do better and do good and not to try and make a ton of money. That's not why I'm in this. I'm in this because I care about how women and men feel. And once I have that mission where I keep that focus, which I've always had, is to do something good for this world and leave it a better place. And if I can make someone feel younger and more beautiful, then I'm giving back. And it's not just a skincare line. It's more than a skincare line. And that's what's most important to me.
I love that. That's great advice. Well, thank you so much, Angela, for coming on the Glossy Beauty Pod. I'm excited to share this episode with everyone. And thank you for listening to this episode of the Glossy Beauty Podcast. If you enjoyed it, please leave us a rating and a review on Apple Podcasts, Spotify, or wherever you're listening. And for even more coverage on the beauty industry and more, please visit glossy.co/beauty.